Good afternoon, everyone. Thanks for joining. This is a pleasure to talk today. It's a pleasure to talk today. For people who don't know, at Brigham and Women's, we have a close relationship with Massachusetts Alzheimer's Disease Research Center, um, and uh, and it's a pleasure to give this talk. And I want to say that I'm going to move through pretty swiftly, but hopefully methodically, and hopefully do justice to this topic. So here's the structure for my talk. So I'm going to give some background about cognitive aging and dementia. Then I'm going to talk about past and current studies in specifically this topic of brain health and dementia risk reduction. What is the evidence? Then for the second part, I'll talk about brain healthy behaviors and some specific research within that category of kind of what you can do, what we know is evidence-based for lifestyle. And I'll end talking a little bit about the AHEAD study, which is a prevention study using a medication, and more on that. And then we'll segue into Donna Walker, who is a participant at Brigham and Women's AHEAD study trial. So let's talk about give a kind of overview for how we think about the brain as it ages over time. So if you take a look at the schematic, you can see that on the x-axis here is age. So you get older going from left to right. And on the y-axis is cognitive function. And you can see that there are a couple of curves. So if you see this purple dashed line, you can see that there is decline with age as you go from left to right with what we call normal cognitive aging. This might not be something that anyone really wants to hear, but we all know that there are changes with normal aging, and this is part of the life course. And then on this curve here, you can see this blue curve is maybe we can call it like a disease curve, where there's some process that's going on that's different than normal aging. And you can see that there are 3 different categories, and so we'll talk about them. So first, when people have symptoms, when people experience and they have the sense that there's memory loss, but in fact, they test normal on memory testing, let's say in the health setting, we can describe that as subjective cognitive disorder, or SCD. And this term preclinical that you see here also implies that someone doesn't have symptoms yet, but there's something going on in the brain that's different than normal aging. So SCD, or subjective cognitive complaints, as a term itself is a risk factor for Alzheimer's disease and other dementias. It doesn't mean that people who suspect there's a problem, but that testing is normal, are definitely going to have a disease. It's just that we've seen that when you follow people over time, people that have this worry can sometimes develop the disease. Then when people actually have difficulties with memory and thinking, that's documented or that is objectively found on cognitive testing, we call this category mild cognitive impairment, or sometimes the term prodromal dementia, which just is kind of like this in-between category between cognitive aging and this term dementia, which we'll get to in a minute. So this is when memory is abnormal for age, but that it hasn't caused yet any interference with daily activities or functioning. And then the third category is dementia, which people have heard of this term for sure, which really is just a description which implies that there's enough memory problems, that there's memory or thinking problems, that there's been an impact on someone's daily functioning. And that can include what we call things like instrumental activities of daily living, like cooking, shopping, etc. And so there's close to 15% of people that are over the age of 71 in the United States meet this description of dementia, where cognition is interfering some with daily functioning. And of course, having mild cognitive impairment itself is a risk factor for development, meaning if you're in the development of dementia, if you're in the in-between kind of phase of brain changes where it's different than normal aging, but it hasn't yet caused interference, up to 15% chance per year for any individual that they will then decline into the memory and thinking actually impacting daily functioning. So I want people to just think about this curve as we talk about lifestyle and then eventually medication as a way of thinking about how you can intervene early and proactively to try to bend the curve. Now, everyone's curve is different. So even though these, think of these as averages. So everyone has some change with normal aging, but you can imagine that, you know, some people at a certain age are very similar to their cognitive function as they were 20 or 30 years prior. Some people are not. And again, we distinguish between a disease curve that we can measure with certain markers and tests and normal aging, but there's definitely different trajectories for all of us, right? And this hopefully is empowering in that diseases like Alzheimer's, as we're understanding, they don't just turn on and turn off. You can have some of the changes in the brain of a disease like Alzheimer's, let's say, or normal aging, and you can do something about the curve, right? We don't know how much, and we don't know kind of what exactly needs to happen, but we know that you know, there's chance for modification of the curve, basically. So then to end this section, I want to leave people with the idea of this concept of brain health. And this from the World Health Organization, I really like this summary, which is that brain health is an emerging and growing concept that encompasses neural development, plasticity, functioning, and recovery across the life course. Good brain health is a state in which every individual can realize their own abilities and optimize their cognitive, emotional, psychological, and behavioral functioning to cope with life situations. And we'll come back to this in a bit, but people, the brain is essentially a vessel as we can think about it, where you can have kind of hits to this vessel over time or protective factors over time that will allow for that define what someone's trajectory is, right? And some of those factors are genetic and some are environmental. But the idea is that there can be there can always be some beneficial change over time to one's curve. And in my interpretation, promoting brain health is, the idea is that for people who are healthy, that we can try to keep them healthy for as long as possible. And for people who already have some cognitive impairment, the idea of optimizing brain function is to reduce the decline as much as we can. So for the sick not to get worse, or to not to get as worse as they could without intervention. Okay, so with that background, let's talk a little bit about some important past and current research in the realm of brain health promotion. So, well, as we do this, I want people to think about this schematic a bit, or take a look at it here. And I forgot to mention one thing, which is that when we say prevention, a more accurate term is probably risk reduction, because we don't know in any aspect of health, whether it's brain or other organs, how to always prevent disease, but we know how to reduce the risk of disease, and we know how to, we're trying to get to the point where we can reduce the severity of it. So here you can see the green circle on the top is early life, then there's midlife in blue here, and then in purple down here is later life. And some of the factors that are contributing factors to the prevalence of dementia are things like hearing loss in midlife, blood pressure, high blood pressure, being overweight or obese, and later life depression, social isolation, physical inactivity. And what I mean by that is to say that there's correlations when you look at a whole population, such that if you were to eliminate people who have eliminate social isolation as a factor for a population, you can reduce the risk of dementia in that population by the numbers that you see in the circle. So in this case, it's 4%. So what this means is that if you add up all of these modifiable factors, right, we can assume that hearing loss can be treated to some extent. We can assume blood pressure can be treated. We can try to treat depression. We can fight physical inactivity. When you add these things up, the potentially modifiable factors that contribute to dementia incidence are up to 40%. So 40% of cases can be potentially modifiable. So I want you to keep that in mind. So if we look at this schematic a little bit to bring that home, you can see the factors that are here in red, we know increase risk over time of dementia. That includes things like impact to the brain. This is written as traumatic brain injury here, hypertension, untreated depression, sleep difficulties, high cholesterol, etc. And on the lower end here, things that decrease risk of cognitive decline or dementia include things like years of formal education. And just to make a note about that, it doesn't imply that one cannot have continuing education in midlife and older life and contribute to reducing risk. It's just that there's correlations with years of formal education and cognitive decline, as well as Mediterranean diet, which we'll talk more about, and social engagement. So just keep these in mind as we walk through some of these studies. So first, on social and cognitive activities, just to highlight some studies so you can see how this research is done. So in a study of over 2,000 women in California, social network size was correlated with reduced risk of dementia and delay or prevention of cognitive impairment. So by social network size in this work, you can look at the number of people that an individual is in contact with, say on a weekly basis, whether it's in person or by phone or by technology. And relatively speaking, the higher the social network, the lower the risk of cognitive impairment or dementia. And so the conclusion specifically was that women with this was a study of women, older women with larger social networks were about 25% less likely to develop dementia than those with smaller social networks, which is an interesting finding. And also in that study, women who had daily contact with friends and family cut their individual risk of dementia by almost half. Not individual risk, but when you look over a population, those who had daily contact had less incidence of dementia than others. Now, similarly, in 2015, there was a large analysis which showed that loneliness or lonely older adults were more likely to become physically limited and had a 20% faster rate of cognitive decline, even on the normal cognitive aging curve. And in addition, loneliness also, depression also accelerated the rate of decline. So we know that untreated depression, significant depression, is itself an independent risk factor for cognitive decline. All right, again, this is highlights of a large body of research, but I want people to just be familiar with these studies. So there is a diet called the MIND diet, which is a amalgam of the Mediterranean diet and the dietary approach to stop hypertension, the DASH diet, and it's a diet that's been studied for brain health. So let's look at the two diets that contribute. So the DASH diet. So if you look at this chart on the right, and just to define both the MIND diet and its two contributors, the DASH and the Mediterranean diet, they both are anti-inflammatory diets. They're generally rich in fresh fruits and vegetables. They have low saturated fats and sweets, and large amounts of legumes and other sources of protein. In any case, we'll come back to that at the end. So you can see on the right here, as years go on, there's a graph here of people who followed the DASH diet that were followed over 10 years. And those in the blue line here who more closely adhered to the DASH diet, the top 1/3, had less cognitive decline. They have a shallower curve over time than those who were in the bottom 2/3 of the population. That's as far as adherence to the diet. Okay, so basically you want to be in this blue curve here, right? The higher adherence to a diet like this, generally speaking, it's not the only factor, but generally speaking, there's a lower incidence of cognitive decline over time. And similar kind of study with a Mediterranean style diet with the same group. And again, the Mediterranean diet, some of the differences are olive oil is the primary fat there, and Mediterranean diet includes moderate consumption of wine, whereas that's not explicit in the other diets, generally thought to be in modest amounts okay and healthy for the brain. You can see a similar chart here where people with the highest adherence to the Mediterranean style diet had lowest rates of cognitive decline. Okay, I want to show you one negative study, not to take away from what we know about diet, but this isn't a study that was just published a couple months ago, so it's an update. It's kind of interesting. The studies I just showed you for diet are population-based studies. They're not starting at one point and saying, all right, this group, you follow this diet, and this group, you follow this diet, and we're going to study you over time and see what happens. Those prior studies are just you follow a large group of people and take a lot of information over time, and then you report what's going on. So in this study, which was a forward-looking study, what's called a prospective randomized controlled trial of older adults, where people are, you flip a coin and you're put into one of these two groups, the MIND diet. In this case, it was the MIND diet, and a control diet where there was just advice on decreasing portions and trying to control weight and generally healthy foods, but there wasn't a specific instructions to follow the MIND diet. You can see that there were actually, by this chart here, where blue is the control diet. So let me show you. So years, this study was done for 3 years. And on the left y-axis here is cognitive score. You can see that after 3 years, these lines of people, the blue line and the orange line here, are about the same. There was no significant difference over 3 years in people followed forward prospectively in the MIND diet versus like a control diet. I think I mentioned this only because it's an update, and if people read, this was in the New England Journal of Medicine, and this was a study looking at the MIND diet. I don't think that this takes away from the volumes of literature we have about these anti-inflammatory diets. I think it highlights that it's difficult to do a study in this way, and it needs to be done again to see if this is the same finding that we find again. It's difficult to start at a time point and randomize, that is, flip a coin and take a number of people and put them into two different arms and sort of study over time. But I think it's worth mentioning, and it's definitely an update in research. And now I want to I think this is the last one for diet. I want to show you a study done several years ago now of 2,300 older adults in New York City, followed for 10 years. They followed and they were advised on a Mediterranean diet, as shown here in this food pyramid. And again, this study showed that higher adherence to a Mediterranean diet was associated with a reduced risk of developing Alzheimer's disease and slower rates of cognitive decline. So again, in one of these charts, you can see that from baseline, from the x-axis, 0 to 10 years, people with the highest adherence to a Mediterranean diet are in this black line. And it means that they had less incidence of having dementia than the other two. So this is an example of a study, like a study I just mentioned, where it promotes a Mediterranean diet as beneficial. Interestingly, there's different mechanisms for why this is the case. It probably has to do with positive effects in the brain, ultimately related to degree of inflammation, control of blood pressure, and this idea of oxidative stress or radicals in the brain, things that are causing cell death and things along those lines. Okay, and then in research, finally, let's talk about multi-domain studies. So there's a bunch of evidence that a combination of behaviors, diet, exercise, social and mental stimulation, stress reduction, that a combination of interventions is beneficial over just one or two. And this makes sense. Like, why would it be any other way with the brain and the body, that general healthy behaviors that we know are good for the brain have some synergy together? They're beneficial. So in this study, where there were two groups of almost 1,900 healthy olders, also in New York City, you can see that were followed for 12 years, and they were their degree of physical activity, their degree of adherence to a Mediterranean diet, were both followed over time. And those who had the most physical activity and the highest adherence to the Mediterranean diet, as shown by this top black curve, had the highest chance of remaining free of Alzheimer's disease over 12 years. So again, it's not just one or the other, it's the combination of those two over time. So the take-home message from this study was that the highest diet adherence and physical activity scores had the best chance of remaining dementia-free over time. So again, this is what we call multi-domain, not just diet, not just social stimulation, not just exercise. Another study done in Sweden followed almost 800 people over time, 75 years or older. These are cognitively normal older adults who did not have dementia. They measured the relative risk of developing dementia over a 6-year study. And the results were similar, essentially that a combination of more mental and physical and social activities were less likely to lead to dementia. And you can see that in this summary table here. That is that the odds of having dementia, of developing dementia over 6 years, were much less in people who had high adherence to 2 of mental, physical, or social activities rather than just 1, and certainly much lower than people who had a low score in all 3 of those components over time. Okay. So I was wrong. There's one more. Actually, there's 2 more studies, but these are prospective studies. So now we're starting at a time point and we're randomizing people. So in the FINGER study done in Finland, it was a 2-year multi-domain lifestyle intervention study, 1,260 people over time, age 60 to 77. They were randomized to, this was a very intensive lifestyle protocol where they had multiple times a week of dietary counseling, exercise, cognitive training, and management of their blood pressure, cholesterol, and diabetes if they had it over time. And this result was a cognitive measure. They were looking to see, after 2 years, when you enroll people in an intensive multi-domain lifestyle intervention who are cognitively normal, compared to those who are in just a control group that just receives education, is there a difference in their cognition over time? And in fact, this was a positive trial. It showed that there was modest improvement or maintenance of people's cognitive level in the intensive intervention compared to the control. So this was a really landmark study because it hadn't been shown before that you could enroll people in a program and achieve this result. Even if there's debate about the modest improvement, remember, these are people who are now 2 years older as well. So the fact that they had some improvement in their cognition is also notable because these are folks who might have had changes with normal aging. So even though the margin of improvement was not significant, it was still a really important study. And this FINGER study in Finland actually launched a worldwide network of studies like this, one of which is ongoing in the US called the US Pointer Study. With our 7 sites in the US, they just stopped enrollment last year actually for this study. But this is the Alzheimer's Association study. And just to show really briefly, this is a large, well-funded study through the Alzheimer's Association. It's already enrolled. There's 7 sites across the US, but they're doing the same thing as was done in the FINGER study by allying with YMCAs and local community centers to carry out this intervention over 2 years for the same population, older adults. So, and just to show, I think this is really neat. So this is the worldwide network of studies and research going on in this multi-domain lifestyle trial like the FINGER study. You can see here a map of the world, and the countries with ongoing studies that are existing are in blue. So there's most continents are involved here, and studies that are in the planning stages are in the light blue. So dark blue and light blue, excuse me. So this is really exciting and really important for lifestyle intervention research that eventually will yield, hopefully, recommendations and plans for what to do in clinics and health systems. Okay, and then finally, another positive study in this multi-domain category. So this was actually just published in this month, but it was published online a couple months ago. So this is called the SMAART study, also positive in its effect, in its results, that is. It was a single site randomized trial of smaller, only 170 older adults, done in the state of Washington here in the US. People had to have a risk factors, at least 2 out of these 8 risk factors for dementia. So physical inactivity, uncontrolled blood pressure, poor sleep, high depression symptoms, uncontrolled diabetes, etc. You had to have at least 2 of the 8 to be enrolled. It was a 2-year intervention, 2-year study, with similar to the FINGER study, where it was 1-to-1 assignment, health coach versus a control group. And people either had coaching sessions, which were every couple of weeks, or they had materials emailed to them without, or mailed to them without any individual one-on-one coaching. And they looked at cognition, that was the primary outcome, as well as change in dementia risk factors and quality of life. And what this study showed,
or dementia.
So you want to be in the blue, blue here, in the, I guess it's dark blue. What this study showed, that dark blue is above the orange in all of these graphs. This is cognition. This is risk factors for dementia. So about similar risk factors from beginning to 2 years. And then ultimately, this is quality of life. So what this study showed was that in a 2-year personalized multi-domain intervention, you can have improvement in all 3 things that they studied, really, which was a composite measure of cognition. So people actually improved, just like in the FINGER study with cognition. Their dementia risk factors, meaning if you take all 8 of those things and you sort of look at where those are 2 years later, were about flat, but maybe modestly improved. And then quality of life improved over time. So this was a clearly positive study. Again, it's getting at the same thing as those prior 2 studies I mentioned. So some take-homes from multi-domain interventions, meaning multiple things like exercise, diet, stress reduction, keeping up with your health conditions like blood pressure, cholesterol, etc., that if you take lifestyle and behavior seriously over a couple of years, there are measurable results in cognition, risk factors, and quality of life. And that, importantly, these results are really individualized and personalized, which means that some may see more results, some may see less. There's contributions like environment and genetics and things like that, but everyone can shift their curve to some extent. This is what this research is supporting. And starting earlier and younger with healthy lifestyle is probably better over time. 1 or 2 points in research about what else to do. So this is a study which showed that intensive blood pressure control is better than less intensive control over time. Essentially, with a top number of systolic blood pressure less than 140 compared to systolic blood pressure of less than 120, people who had the more aggressive blood pressure control over time, this is cognitively normal older adults, pretty large group, about 9,000 of them, had less progression to dementia with more intensive blood pressure control. So this is an interesting result from a couple years ago that has an impact on what we do in the neurology clinic when we're talking to people about memory disorders, that if they have uncontrolled blood pressure, again, it's challenging to look at these exact numbers and decide, okay, I need to be at this blood pressure level and this person needs to be at this. This is something you have to talk with your provider about, your primary care or cardiologist about. But this is just evidence that probably a little more control, lower blood pressure than we might expect is better. Lower blood pressure than what are in the guidelines in certain cases is probably better for reducing dementia risk. Again, something to talk with providers about for sure. Okay, so brain healthy behaviors. What can you do given all of this research and where are we? So first, cognitive reserve. If normal aging is in purple, and if the disease curve is in this light blue, so as you get older over time, cognitive function decreases. Cognitive reserve is the idea that there's some resilience where you can bump your curve up. So at the same age that someone is, you can have higher cognitive function if you sort of do these brain healthy behaviors. And we call this reserve or resilience of the brain, okay? So the goal is to build cognitive reserve and brain resilience. And here's just a schematic to help understand this. There's different factors that go into this. The modifiable health factors we talked about today, brain training or cognitive training. Again, that doesn't have to be a particular program where you're following cognitive tasks, but it can be cognitively stimulating activities. We'll get back to that in a moment, but these are the contributions, the main contributions to what we call cognitive reserve. So physical activity, diet and nutrition, social activity, cognitive activities, combined with stress management, good sleep, and overall health are the best weapons against dementia. So it's a set of behaviors that's more effective at slowing the rate of conversion from, remember, if we go back to subjective cognitive decline, where you're worried about memory, but memory testing is normal, the conversion of that to actually having cognitive impairment can be slowed by a set of behaviors rather than just one of these alone. Healthy brain, healthy heart. Brain health is heart health. We know this from a lot of different studies. Here are some headlines which emphasize this. We know, here's some details about physical activity. So there are a number of studies that show that 30 to 60 minutes of cardiovascular exercise 3 or more times a week has been associated with lowering the risk of progressing. So if you have some cognitive impairment already, again, this is good guidelines for everyone, but there's some research that supports that if you already have some cognitive impairment, you can reduce this rate of conversion to dementia. And that if you already have, for patients who have dementia, that their daily cognition can be improved with exercise, actually. So even though you're not changing the underlying biology and stopping the brain changes from happening, there's some evidence that you can improve daily cognition for those folks. And this is from the American Heart Association, some target heart rates when we're talking about cardiovascular activity. Okay. Some examples can be exercise walking outside, can be using a machine like an elliptical or stationary bicycle, any of these things. For people who have some physical limitations, it could be rowing, like a rowing machine. If people don't have access to a machine, it can be doing calisthenics or other activities that increase the heart rate. Remember, if we go back and look at the, the heart rate targets, you want to kind of cardiovascular activities defined by bumping up your heart rate, to these ranges. So any of these, it's not one that matters. It's not that, stationary bicycle is better than a video exercise class, for example. The idea is to increase heart rate, to feel slightly out of breath, and to sweat lightly. And strength training, that is training that has some resistance with some weights, can also be helpful. And we know that cardiovascular is probably more important for the brain, but strength training is also somewhat important for the brain and good for overall health. All right, and then some details about diet. So the Mediterranean style diet. So here are just some things to kind of capture in your mind. So fresh fruits and vegetables, beans, lentils, and nuts, fish, whole grains, olive oil, and then in moderation for a Mediterranean style diet, poultry, eggs, dairy, alcohol, and then avoiding concentrated processed sweets, that have refined sugars as opposed to natural sugars like honey or maple, are things to avoid. Generally speaking, saturated fats and red meat. And this is a helpful specific kind of instructions, so to speak, on brain healthy diets. We can probably circulate this, but I wanted to show people that people have looked at what it means to have whole grains as part of this diet, green leafy vegetables, other vegetables, servings of nuts, etc. So keeping the brain active and challenged alone and with friends can help preserve memory and processing speed. We know that learning new skills and staying active in the community is part of this. Activity in both mid and late life have shown to have protective effects. And again, so the proposed mechanisms of this are that you have secondary benefits through better sleep, through some biological effects of physical activity, etc. We know that social connection is good for the brain. We don't exactly know the mechanism, but we know that it's beneficial. So crosswords, jigsaw puzzle. All right. And then sleep. So if the CDC says that if people are 18 to 60 years old, they should have 7 or more hours of sleep per night. If they're 61 to 64, they get a little bit more, 7 to 9 hours. Again, I'm just showing you this as a reference. And if people are older than 65, let's say 7 to 8 hours. So they're required an additional hour. So generally speaking, let's say that 7 hours or more is kind of good for sleep. I would say that everyone is different, and there are people absolutely who need less sleep, who don't feel tired during the day, who are not dozing off. And then there are people who need some more sleep. So this is like an average kind of recommendation of sleep. We know there's a relationship with sleep and the brain. So some general tips to improve sleep health. So be consistent. So going to bed at the same time or relatively the same time each night and getting up around the same time, even on weekends, can be helpful. Getting good exercise can get good sleep. Being physically active, right? It helps with sleep initiation at night. Making sure one's bedroom is dark and relaxing, or whatever wind down routine they have for sleep is important, including comfortable temperature in a quiet room. Decreasing overstimulation at night before bed. These are these kind of sleep hygiene behaviors that people are going to be generally familiar with. It is important for and are important for trying to get good sleep, and then avoiding large meals, caffeine, and alcohol before bedtime. Okay, we're almost there. So stress, not good for the brain. High stress activates bad responses in the brain. It's been shown that this has a direct detrimental effect on neuronal health, on cells in the brain, on plasticity. It itself can increase risk factors, of course, because high blood pressure increases stress can increase blood pressure, et cetera, which has an indirect effect on the brain. So some things to think about: mindfulness training, focusing on the present moment. And there's each one of these that I'm describing could have its own talk, right, as we know. So I'm just giving you some highlights here. Techniques including breathing exercises, physical relaxation and meditation. We know from studies that mindfulness increases memory, self-efficacy, and also can have impact on brain volume over time. And mind-body activities like Tai Chi or yoga are beneficial for both stress reduction as well as physical agility and other things. And there's been studies that show that people are mentally sharper when they engage in activities like Tai Chi and yoga. I'm going to say briefly that over-the-counter medications, prescription medications, and substances like marijuana and nicotine all have to be considered. And it's important to know that over-the-counter medications can have some cognitive side effects, especially like the active ingredient in Benadryl and things like that. People may notice this, but even if not, there are alternatives, and it's something to consider. And also just speaking with your doctor or providers about prescription medications that can have some cognitive side effects. This should be the role of a provider to talk about these things. Blood pressure, targets, cholesterol, diabetes, and metabolic syndrome, as well as depression. These are all sort of guidelines of medications and other interventions and brain healthy lifestyles. Intervening early matters. So we know that reducing, if there's a buildup of bad actors or proteins in the brain that we know, and that reducing these and brain health behaviors, that it's probably a combination, as I said, it's going to be a combination to both prevent or reduce risk of Alzheimer's as well as treating it, of both medication and lifestyle. And in fact, for example, this year, there was a medication that removes amyloid from the brain that's called lecanemab that there was a recent talk in an adjacent series to this about. And this medication, lecanemab, is an example of a drug that is being studied in people who don't have Alzheimer's disease to try to prevent it by removing amyloid in the brain early. And I want to just kind of put in a plug here for the AHEAD study, which is a global study that we're one of the sites running at Brigham and Women's, where people can be enrolled in the AHEAD study. We're still enrolling for this study. If you are age 55 to 80, you haven't been diagnosed with Alzheimer's disease, but may be worried about memory loss in the future. It's a 4+ year study, so it's a big commitment, and it's a medication study. So there's an assignment into a group that has medication versus placebo. But in any case, these are all considerations, and you also have to have a study partner, which means that someone has to be available to come in. It's actually about once a year only. And during the initial screening process, we can talk more about it. But essentially, the AHEAD study is an effort to try to use a medication to reduce the brain changes that we see in Alzheimer's disease. I'm going to turn it over to Donna Walker. Do we have Donna here, Nancy?
She's here.
Excellent. And Donna is a participant in the AHEAD study at Brigham and Women's, and she's going to talk a little bit about her experience in the study. And then after, we'll come back and we'll have time for questions.
Oh, okay, there it goes.
Yes.
Hi, everyone. I'm here. How's everybody doing?
Great, thank you, Donna.
Okay, my name is Donna Walker, and I'm part of the AHEAD study, and I'm an ambassador for Alzheimer's research. Basically, the reason why I wanted to do the Alzheimer's research study is because my mother and my grandmother had Alzheimer's, and I just wanted to see if I was a person that would initially get Alzheimer's. So I signed up for it and at their head study, and it's I've been doing it for a couple of years now, and they do all the testing. I do what's it called? See, I can't remember stuff. So that's another reason why I'm doing it, because I'm always forgetting things. So I just wanted to make sure, like, the next generation in my family, if they had a chance to avoid having Alzheimer's, the study would help them or help anybody in the future with not getting Alzheimer's, or a medication to avoid getting Alzheimer's. So they do a lot of testing. I do what is it called? Seth, what is it called? You know.
Your memory testing, maybe,
Yeah,
or
we do the memory
yeah.
testing, but when they do with the needle and everything.
So probably blood draws. You're talking
They
about the
no,
blood.
the not the blood draws, but the
Oh, the infusions, getting the
infusions.
medication.
Okay,
Yes,
yes.
getting
So
the medication by.
I do infusions, and I do infusions maybe once a month, and I get a stipend, and they do MRIs, and that's probably maybe about once every 3 months, to check your brain, and also we never know if we're getting the medication or the placebo, but that's part of the study, so they don't let you know, because if you knew what you were getting, it wouldn't be a good result. Um, so I so it I don't know what else to say.
No, that's great, Donna. And you can, I think we'll have time for questions. And thank you for sharing. And
Also, I learned some stuff today about about the food that you eat, and and the exercises that you do and stuff like that. Which stuff you never told me about all this, which I just found out. So this is and actually I have been exercising a lot more lately and eating better. So hopefully when I start doing more testing, I'll have a better result. So, but another thing is that they don't never tell you what your results are. Like, I don't even know when will I find out anything, Seth?
right. So that's a good question. So just to mention a couple things. So of course, in this AHEAD study, both we as a team and people who are participating in it intentionally don't know whether someone is getting the medication or placebo, right? That's how you have to do a study to understand it. And any information that has relevance for people's health now, like say a blood test which shows a thyroid problem or something on the MRI, that of course is discussed in a study, and your health is paramount to the study. It takes precedence over it. So Donna, information, as you know, that has any immediate action items or relevance is shared.
Mhm.
The stuff that isn't shared intentionally until the end of the study are things like, what did we find on the different kinds of PET scans over a population? Were the PET scans better for people over time? That can, if that's not available yet, and that can bias how you interpret
Okay.
results and stuff. Yeah. So I
All
think
right.
it's important to recognize that for everyone.
And initially, when you in order for you to qualify, they do the PET scan to see how many amyloids that you have. And I didn't have a lot, but I had enough to be able to qualify for the study, for their head study. Some people should like, because most of the people that get Alzheimer's are minorities. So we need a lot more people to join in with the study to participate. We definitely need a lot more people in there. So if you're willing to, please join their head study.
Thanks, Donna. Yeah, and again, people can find more information. I think Nancy or Lenore will drop information into the chat and about the AHEAD study. Again, that's to make the point that it's going to be a combination of factors in both treating Alzheimer's and reducing risk. Sorry, combination of interventions, like the lifestyle stuff I talked about today, and then also most likely medications.